Welcome to this community care presentation on behalf of ARAS. My name is Deborah and I've been working for the Aged Rights Advocacy Service for the past 12 years. I'm currently a senior advocate working across all of ARAS programs. Some important information about ARAS. Firstly is that it's a free service. Older people pay a contribution towards aged care services, so it's always good to know that if they need some advocacy support, there's no extra cost attached to that advice or information. The other piece of good news is that we're a confidential service, so no information about you will be passed on to anyone else without your consent. So ARAS provides information to individual older people, to groups of older people, such as in clubs and associations, so we can do face-to-face presentations to those groups or clubs. And we also provide education to service providers so that they understand their obligations to you as a consumer of aged care services. So I've mentioned the word advocacy a few times. So what is advocacy? Simply, it's a process of helping someone to understand and exercise their rights. It's helping older people to have a voice and a choice in the services that they use. The role of an advocate is to take the side of the older person and to represent their views to the service provider if a problem arises. A good analogy, I think, of advocacy is that it's a bit like holding someone's hand to cross a busy highway. We don't push you out in front and we don't drag you across the highway. We go with you along that road and we make sure that you agree with the actions that the advocate is taking and that we know exactly what your wishes are. ARAS has 6 key service areas. Residential aged care, which, as the name implies, is for people living in residential aged care facilities. Community care, for people using Commonwealth Home Support Program services, which might include services such as domestic assistance, shopping, and some light outdoor maintenance. And the home care package service, which might include services such as personal care, medication management, and wound treatment. Our elder abuse program supports older people who may be experiencing or at risk of experiencing abuse from someone they should be able to trust. The types of abuse that older people experience include physical abuse, financial abuse, and psychological abuse, as well as neglect. Retirement village residents can obtain support from ARAS in relation to any contractual arrangements or agreements that they may have with the village operator. ARAS can help people prepare for tribunal hearings with the South Australian Civil and Administrative Tribunal, and in some cases we can attend the hearings with the resident. Recently, ARAS was successful in obtaining funding for the Aged Care System Navigator trial. A navigator specialist can assist older people to access and navigate the aged care system. We have an Aboriginal program supporting Aboriginal elders to ensure services are delivered in culturally appropriate ways and so that Aboriginal elders can have access to mainstream services. We're all born with human rights. We've all heard about the Charter of Human Rights. In the aged care sector, there's a Charter of Aged Care Rights. So when you take on an aged care service, in addition to the human rights that you were born with, you have 14 aged care rights. Your service provider has a responsibility to make sure that you have a copy of the Charter of Aged Care Rights and that you understand the implications of those rights and the attendant responsibilities that the service provider has to uphold those rights. ARAS can help you to understand the Charter of Aged Care Rights and provide you with a copy if you don't have one already. The first of those rights is that you have a right to safe and high quality care. Not average care, high quality care. So if you feel that the care that you have received from a provider is not of a high quality, you have a right to speak up about that, to try to do something to ensure that that care is of a high quality. You also have a right to be treated with dignity and respect. And for many people, that means different things. For some people, it's about the way that they're addressed, whether it's Mrs. Jones or Gladys, Bluey, Smithy, whatever you're comfortable with. For some people, dignity and respect goes further, and it's about having your home respected, so that when a worker comes to your home, they don't just walk in the door. They should knock on the door and treat your home respectfully as your domain. You have a right to be informed about the care that's provided to you. Not to just have a service provider tell you what they're going to do, but to be included in the services that are provided. So you have a collaborative relationship with that service provider, rather than in the very old-fashioned way of the service provider being the expert and knowing what's best for you. You know what's best for you, and you know what services you need. Another important right that you have as a user of aged care services is to be listened to and understood. And you also have a right to have someone to help you to speak up and to be listened to and understood. So that's where ARAS comes in. Under the Aged Care Act of 1997, ARAS can help you to speak up about your rights. You have a right to complain. It's one of the rights in the Aged Care Charter. And when you complain, you have a right to do that without your services being adversely affected. Sometimes people are reluctant to complain because they have a fear that their service will be discontinued. But that can't happen. Under the Charter of Aged Care Rights, it's very clear that you have a right to make a complaint and for your service not to be adversely affected. The question we're often asked is, how can ARAS help me? In the community care program, ARAS can support you right at the beginning of taking on a Commonwealth Home Support Program or home care package service. We can help you when you're establishing an agreement or contract with your service provider. We can help you in establishing your care plan. We can help you to negotiate any fees and charges that you may be asked to pay. And of course, we can help you through the process of lodging complaints or raising issues of concern. When issues arise and people have a problem or a concern with a service provider, people have told us over the years that they're a little bit reluctant to go directly to the service provider. Sometimes they don't know who to talk to. Sometimes they tell us that they've tried raising concerns in the past, but they haven't been able to achieve an appropriate outcome. So ARAS is able to support you right from the beginning of when an issue arises. We can talk to you about different ways that you can communicate with the service provider, either face-to-face, of course, or over the phone, or we can help you to write a letter if you would like to take a more formal approach. You can advocate for yourself by taking those steps after obtaining some suggestions from ARAS. Or ARAS can act on your behalf. We're very happy to talk to service providers, to raise the issue on your behalf and to help you to resolve the concern that you have, to ensure that your rights are upheld as a user of that aged care service. A very important right that older people have is the right to live without abuse and neglect. And because it's so important, I'm going to be careful to read the definition of elder abuse. Elder abuse can be defined as a single or repeated act or lack of appropriate action occurring within any relationship where there is an expectation of trust, which causes harm or distress to an older person. Elder abuse can take various forms such as physical, sexual, psychological, financial, and/or neglect. Older people have a right to live without abuse or neglect, and the Aged Rights Advocacy Services Abuse Prevention Program can support people to access appropriate professional services if there is abuse in their lives. We can also support people who feel that they are at risk of abuse and help them with safeguards to prevent that abuse from happening. ARAS works closely with the state government. SA Health has an adult safeguarding unit which was established in October 2019. The adult safeguarding unit accepts reports from people who are concerned about an older person who is at imminent risk of harm. Adult safeguarding unit officers have investigative powers. ARAS promotes safeguards to prevent elder abuse. Plan for the future. Think about donating power of attorney to someone you trust. Think about an advanced care directive so that you have a substitute decision maker if you're not able to make decisions on your own at some time in the future. Remain active in the community. Keep up your membership of groups. Maintain connections with trusted friends and family. And be as independent as you possibly can. Keep doing for yourself the things that you're able to do. And be safe. Plan to be safe. Think about connecting with the South Australian Police Home Assist program to come and check your home to make sure that you can live safely and as independently as possible into the future. ARAS operates a program called Safeguards for Ageing Well, which is funded by SA Health, the Office for Ageing Well. The program promotes 4 key messages: stay connected, stay active, stay healthy, and stay in control. During the COVID-19 pandemic that we're all experiencing at the moment, it's become a little bit more difficult for people to stay connected. But there are electronic methods, as you're experiencing right now through YouTube, to stay connected with people, to obtain information, to meet with your friends, to keep up with what's going on in the world, express your views, and just generally join in. And you can also stay active through those means. There are some online programs that people can use to exercise. But in South Australia, we can get out and walk. We can visit national parks, get out into the fresh air and be active while maintaining safe distances from other people during this time. Staying healthy is really important. Visit your doctor. Maintain your medical regimes. Keep in touch with any allied health professionals. And generally, think about how you can stay as healthy as possible by having a healthy diet, getting that exercise that I mentioned earlier, and staying in control. Those other three things will help you to stay in control, but it's important for you to maintain the control of as much of your life as you possibly can. Make your decisions. It is your life. You know what's best for you. Stay in control. Stay healthy. Stay active. And stay connected. That's the end of our presentation. If you have any questions or concerns, or would like to order brochures, please contact the ARAS office on 08 8232 5377 or toll free 1800 700 600. Thank you for listening, and I'll see you soon.